Good afternoon, ladies and gentlemen. Welcome to my show, Lifestyle with Dr. Mobi. This is Dr. Mobi, and I welcome everyone nationally, internationally. Today, we're going to talk about basically lifestyle effects of sleep. We have a great guest, and one of our great sleep tech, Mary, and she's going to highlight a little bit about sleep. But before we do that, I'd like to point out a few things about diet, sleep, real quick for audience. So sleep is very important part of our overall health. As you can see that we spend one third of our life is in bed. And this is the time where body rejuvenates for next day and neurochemically as well as physically. So both are very important because then people are tired, exhausted, and if they don't get enough sleep, then they will be having problems next day with concentration or falling asleep or so forth. So pay attention to sleep hygiene, make sure you sleep enough hours, and quality is very important. And if there's a problem with any of the symptoms, snoring, sleepiness, or interrupted sleep, or leg movements, or other problems, make sure see your provider. Make sure you discuss with your provider and see a sleep doctor and get full evaluation. This is for educational purpose only. We want to highlight importance of sleep. As you know, sleep has a lot to do with cardiovascular health. Now we have COVID-19 too, and there's a lot of talk about immunity, and people are having also a lot of nightmares about COVID. I'll talk a little bit later on that. But one of the important components of immunity is sleep because that gets you all the immune system ready to fight any kind of infections. There was actually study about people sleep less than 4 hours, they are more likely to catch flu infections and or have flu or viral infections. So I assume that also stands true for any viral infection because your immune system is down. So we welcome Mary. Mary, we welcome you to our program. How are you doing?
I'm doing well, thank you.
Okay, tell us about yourself. What do you do, and what is your experience as a sleep tech or a student?
So I am a sleep tech. We do many studies for obstructive sleep apnea, narcolepsy, PLMs, or periodic limb movements, just to make sure you're getting the quality of sleep. And if you have any diagnosis, that's what I screen for. Um, I am also a student. I go to school at BCU, um, and so I am trying to maintain work and school with healthy sleep as well.
Okay, great. And one of the important aspects is, making sure we have a proper diagnosis of somebody with sleep disorders. We do sleep studies. So one of the things we'll talk with her is some of symptoms or some of patients, they come with feeling tired, exhausted, or they could be very sleepy during day. So, what are your experience with people mostly have more problem with concentration, driving, or sleep, or all of the above?
Well, sleep has a lot to do with concentration, even your vision.
Hmm.
So those are definitely symptoms that can lead to a sleep disorder.
Hmm.
I see a lot of my patients that I talk with, they complain of vision issues, lack of concentration in school or at work, which in doesn't do well with their productivity. So we try to catch that. And if they have a sleep diagnosis, once they're diagnosed, they are usually improved.
Okay, great. So one of the ways we do sleep studies is we bring them here overnight and we study their brain waves. That tells us whether they're having good architecture-wise sleep or they're waking up a lot or not. And second is if they're having issues with oxygen, so they can stop breathing, which would be like apnea or hypopnea, where there could be partial blockage. or there could be respiratory arousal, so they're waking up throughout the night, and then having problems in terms of their um, episodes where their oxygen kind of tanks down, or they have these episodes going. So one of the studies we do is overnight, and the other study we do is a home study, and we talk a little bit on that. And then few disorders, I think, which we like to highlight for people. One, of course, is obstructive sleep apnea, which is more prevalent in men than women. And some of the sign symptoms will be, snoring, sleepiness, fatigue, and some of the screening parameters we look at: if you have BMI over 25, neck size over 17, and if you have you stop breathing at night, blood pressure, atrial fibrillation, congestive heart failure. All those are very important in terms of somebody's evaluation as for sleep disorders. What is your experience? Is it also prevalent in females?
I noticed that a lot of our females are older,
Mhm,
going through menopause. Um,
mhm,
so I do see a lot of women in that age group, as well as children sometimes come in that are don't have their tonsils taken out yet, and they have symptoms as well.
okay, and that is a great point, that in kids it manifests as a little bit different, and a lot of relationship to tonsils, and they tend to be very hyperactive, or they have hyperactivity. So it's very important for behavior wise we look at kids, and to make sure that they are fully analyzed and so forth. So other thing, one of things very prevalent also when we talk about kids, teenagers, and young adults is narcolepsy. So tell us a little bit about narcolepsy.
So personal experience, I have narcolepsy. I was diagnosed actually as a child with ADD. I was not diagnosed properly.
Mhm.
I showed a lot of symptoms in school of ADD, unable to concentrate, finish my schoolwork, but it was due to me being so tired I couldn't concentrate. I see
Mhm.
that a lot in children. It comes in as ADD, ADHD.
ADHD. So tell us what was feeling like with narcolepsy. Was that more nightmares at night, or more concentration, or sleepiness, or all?
It was everything. I did have nightmares consistently as a child, and still as an adult, I do that today. Um, I was unable to concentrate in school. It seemed almost like a lack of interest, but I was unable to. I could read a passage and unable to tell you exactly what I just read, just because I could not comprehend due to exhaustion. I was just exhausted all the time.
Okay, and that is very important, that people think that is being, labeled as lazy, or or they have other problems, lack of interest. But actually, there could be problems, like you said, there could be problem with getting sleep study or evaluation, and maybe looking for narcolepsy if you have a proper diagnosis, and you go through the night and day study for that. Other things I would like to also point out: was there any sleep paralysis, or?
I do have sleep paralysis as well, yes. I will fall asleep and think that I am awake. I
Mhm,
can see myself in my dreams, and I'm unable to move.
mhm.
But I think that, or I'll fall asleep, I'm watching a TV show, and I finish the TV show in my dream, and I'll wake up and I never watched the movie. So my dreams are very colorful and vivid and real. So it's very
Oh.
hard to decipher.
Well, I mean, thank you for sharing your personal experience. I know
Mhm.
it means a lot for somebody to share their, and this for educational purpose, for people to realize that, pay attention to your symptoms, making sure talk to your doctor, and don't ignore it. Look deeper with the provider, and making sure if anything has to be done for it, we are here for you. So tell us also about were there any emotions that would make it more uh, bring on these attacks?
Yes, stress. If I'm under a lot of stress, I sleep more. Um, but if I maintain a healthy sleep schedule, I usually do pretty well.
Very well. Okay, great. Okay, so one of the ways we do narcolepsy check is somebody that comes at night when after getting proper history and so forth, we do their overnight study to make sure they sleep enough hour at night. Because if we run the daytime study with it, then you will flunk that study. So the daytime study consists of naps, and those are 4 or 5 naps. We can get answer early sometimes, but if we see, so we're looking at two things in that. Those are if they have pathological sleepiness, which is they sleep very quickly, and they have other things would be in terms of their have sleep onset REM, so which we're looking in these naps. And also we can also look overnight study if they slept earlier, and the REM, which is the dream portion for audience. So sleep is basically two-third non-REM and one-third REM, which is dream and non-dream. Vivid dreams, actually, I would say those are simple dreams or versus so forth. So those are important diagnostic things we do to diagnose somebody with narcolepsy. And some of the causes are actually could be viral. Actually, it is very prevalent after flu or flu shot even. And it has genetic basis, so it can run in families. And but luckily, more cases are non-genetic. You can do a genetic test, but it's also positive in normal population. So then, for somebody with narcolepsy, how is any life different after you started treatment? Is it better for you? Do you feel better?
It is. Once I started treatment, my GPA went up from C's to straight A's. Um,
Oh, great.
yeah, I was able to concentrate in school. I'm able to comprehend as well, and I'm
Mhm,
happier. I don't feel lazy. I don't feel unmotivated. I
mhm.
As long as I keep a healthy sleep schedule, I feel pretty good, much better.
Much better. And what about any sleep paralysis or those better?
They're getting better. I do have very vivid nightmares, um, but they're off and on.
They are often. And what about, I think you've mentioned sometimes stress brings, or sometimes being in maybe in a stressful situation, or even that you would have momentarily these attacks. These can happen, right?
Yes. So I try to stay as calm as I can.
Hmm.
I'll go to take my mind off it. I do exercise to try to calm my mind down a little bit, and that tends to help as well.
Okay, great. And also, things is that I see that you maintain good, healthy lifestyle. I mean, you pay attention to what you eat and keep yourself healthy. Very good. That's an important consideration, because you don't want to develop another disorder with one which could be, from getting sleep apnea or something on those. So those are so that is great. And what about the treatment in terms of uh, have you seen more side effects or effects?
I do well personally without a antidepressant to manage my dreaming due to the side effects, but a lot of my patients they really find it useful to use antidepressants. So I think it's just person to person.
Person to person. So everybody varies depending on how their response to medication is also, of course, genetic. So there's genetic variation, and there are a lot of new medication out. So some of the medication we use are stimulants, which are Provigil, Novigil, and Adderall, Ritalin, or any of those. And then we use some antidepressant to suppress the REM portion, which would be Prozac. SSRIs, and then we have the new medication out also, and that's a new thing. So hopefully that will help a lot of people with symptoms. Now we have also other medication which are controlled, and you can use those, but they have a lot of side effects. And in terms of you have to take those medication basically in middle of night or so forth. And now about the dosing, what time you prefer taking, noon or morning or both?
I take both.
Both. Okay, and that helps. So the sleep through the night portion has improved too, or I assume so.
It has, yes.
Okay, great. Okay, so that's great. And so tell us then any advice for the sleep patients. You have your experience. I know you work in that field very well. So what do you have for audience to?
Just to maintain a healthy sleep schedule, once your body gets used to that and you maintain it, it does a world of difference.
Okay.
No phone, TV 30 minutes prior to bed, no sugar, and try not to exercise right before you go to bed, and let your body relax, let your mind relax, and again, maintain that healthy sleep schedule. And it truly does make a huge difference.
Mhm. Okay, great, great. And now for some the final tip from my side will be making sure, as you said, pay attention to the sleep hygiene. Make sure to talk to your doctor, and pay attention to diet, and there's also importance of exercise. So walking actually steps and is very important. It improves the quality of sleep, and especially you want to do some during day, not very close to your sleep, but if unless you just walk, that is fine, but no stimulating exercises, I would say, because that can really make your sleep problem worse. Other problem is about insomnia. So those are inability to fall asleep or remain asleep, that can be associated with sleep apnea or is a separate disorder. Making sure if you have some stresses in your life, make sure discuss with your psychiatrist, and make sure this is more of problem this more than 6 months, because people tend to learn maladaptive way of incorporating their stress into their daily living and night sleep time, so that the boundary which body has for sleep, so when we hit the bedroom, the mind tends to slow down or fall asleep. They're not doing it because they keep on their laptop or computers or whatever, and then this builds on the mechanism for brain to remember the bad ways. So brain is very smart, it's gonna remember good and bad ways both. So it's gonna remember that it's okay to do these things in watch TV in bedroom, but that will cause people to have problem with insomnia. Pay attention. And Mary, it was pleasure talking to you and discussing. Thank you and coming for our show.
Oh, you're very welcome.
Thank you. Take care, man.
You too.
Take care.